time to visit with our bud, Dr. K, Dr. Kevin Kavanagh. He is a retired physician and also the founder of a national organization called Health Watch USA. Hey, good morning, Dr. K. How are you?
Oh, really good, Jack. Good morning.
Good. Tell us about Health Watch USA. What is that and how's it doing? How's it going?
Well, it's going really well. We're a national and growing international organization on healthcare policy. We've grown quite a lot with COVID-19. We're also a patient advocacy group, meet approximately once a month, and we're going actually quite well during the pandemic. I would, however, trade all of that if this coronavirus would go away. And that's what we're hoping and striving to do with the mission of our group. Kind of like putting us out of business in a way. But there'll be other...
But you started that group well before COVID, so what was the inspiration for starting it in the first place?
Well, we're looking at patient safety issues and focusing on infectious disease. In other words, hospital-acquired infections and healthcare-acquired infections. And we were really concentrating on MRSA and then C. difficile and COVID-19. In fact, prior to the COVID-19 pandemic, we had a number of op-eds, one in the LA Times regarding not being fully transparent and truthful with pandemic information as it would come out, and historically how countries would tend to cover up what was going on. And we also had a large article on disparities, which that one was published in the Lexington Herald Leader, and how with pandemics, disparate populations such as African Americans, etc., tended to fare far worse than others. So we were, I think, ahead of the ball on many of the issues that this pandemic created. And I should add that we just weren't the only ones. The United States government had a very large kind of war game called Crimson Contagion that pretty much predicted every one of the missteps that was undertaken by the U.S. government once the pandemic started. And Crimson Contagion and their findings was largely ignored. So I think our performance isn't where it should be. If you look at vaccination rates, Jack, we are now, I think, about 55th. We're falling behind other countries in the world getting their population fully vaccinated. And so this is very, very concerning. We have the best vaccines, best scientists, best minds, and we are not taking advantage of this like we should.
Well, we have Senator Rand Paul as our first guest this morning between 9 and 9:20. And as you know, Republicans are fighting President Biden's coronavirus vaccine mandates and kind of wielding a new weapon against the White House rules, natural immunity. I know he's going to want to talk about that this morning. Were you here conducting that interview? What would you say to Senator Paul?
Well, if it wouldn't be wise for those that have had a previous infection, just as if you had a previous vaccination, to get a booster to try to get your immunity up for this Delta variant, especially if that first infection was of the original wild type virus. We are getting far too many infections right now in order to say, well, it's herd immunity and everybody's immune. And Jack, when people say mild infections, I think you need to really say, well, some people with this so-called mild infection have the severest infection they've ever had and are developing long COVID. And what gets me is that a frequent symptom, and sometimes it persists, is loss of taste and smell. When I was an ENT doctor over a decade ago, practicing and doing surgery, if I would do a surgery and would then have post-operatively a patient lose their taste or smell, I could be sued for millions of dollars. And believe me, that could happen with nasal surgery. And right now, it's just sloughed off. Oh, that's a mild infection. Don't worry about it. To me, it's just doesn't make any sense why we're not taking this pandemic more seriously. I don't think we're out of this. I think that all politicians should encourage people to go out and get vaccinated and to get the vaccine. And the main thing I would ask Senator Paul is, do you think employers have the right to mandate in the workplace? Do they have that option? Do you think they have that right? Because certainly I do. I think government ought to stay out of the workplace. And if you don't like mandates, which I think if it gets people to get vaccinated, that's the overall goal. But, if you can't enforce a mandate, it's hard to impose one. But certainly, if an employer feels that he should have a safer workplace, if an employer of a small business has, let's say, leukemia or a severe illness and immunocompromised, he should be able to require his workers to be vaccinated. And yes, vaccines aren't 100%. N95 masks aren't 100%. But, and this is very important, but all of this adds a layer of protection. And you're going to have to use testing, masking, and vaccination in order to return our workplaces to a normal situation. Because if you have a group of people who don't want to work in a setting if vaccines are required, Jack, I'd point out that there's even a larger group who don't want to work in an unsafe workplace where people aren't vaccinated. We're not going to get our country back on track with this type of policies.
All right, let's talk about Thanksgiving food safety a little bit here.
Well, and I think this is very important. Of course, we have the coronavirus. We want to make sure that we wash our hands and wash countertops and be very clean. But you know what? We should have been doing that anyways. And two of the biggest things with turkeys, one is you want to thaw your turkey in the refrigerator. This can take, it can take up to 1 day for every 4 to 5 pounds of turkey. And of course, right now, if you've got a 20-pound turkey, you've got an expensive bird on your hands. You don't want to ruin it. And one of the easiest ways to ruin a turkey is to not take the plastic bag out of the turkey before you cook it. When you buy a turkey, it has a plastic bag with giblets in it. That needs to come out. Very important because plastic is quite toxic. It can be carcinogenic, and you don't want to cook the turkey with a plastic bag in it. Now, for us, and we kind of had a mini Thanksgiving dinner actually yesterday. We're having 2 this year to make up for last year. We did home testing of everybody on the front end, including the kids. And we also required everybody to be vaccinated. Our entire family's been vaccinated, or at least 1 dose, with the children. We did have on an air filter, but to be honest with you, during Thanksgiving, masking isn't going to be that effective. I mean, you're going to be eating, you're going to be with your family. And for us, Thanksgiving dinner isn't sitting down at a table eating and then getting up. We kind of graze and feast all day. So you really have to, I think, do other options. And this is what we're doing now. And those options, I think, are home testing and vaccination. And with that, you can have a much safer Thanksgiving and a much happier one than what we had last year.
Well, I wish you exactly that you and your family enjoy your next Thanksgiving as much as you did your first one. And we will talk to you next Monday.
Okay. Thank you, Jack.